Our framework, our framework centers on whole person health and community driven strategies across our programmatic areas. Next slide, please. So, this is our table of contents for today's session. Next slide, please. So, DHHS has 33 divisions under 6 broad service areas, from opportunity to well-being, Medicaid, operational excellence, policy, communications, and health. Next slide, please. So this is our organizational chart. Let me walk you through how DHHS is organized. At the top, the department is headed by a secretary who sets the vision and priorities for the entire agency. Our offices are housed within the health portfolio. Next slide, please. So the health portfolio includes 5 offices, including the Office of Minority Health and Health Disparities, the Division of Public Health, Division of Mental Health, Olmsted, and Office of Rural Health, all aligned to provide essential services and improve health outcomes for all North Carolinians. OMHHD plays a key role in driving equity across these offices. Next slide, please. Secretary Sangwai has established 4 priorities for this year: building a sustainable workforce to support a healthier North Carolina, strengthening access to healthcare in all North Carolina communities, advancing whole person health to strengthen child and family well being, and ensuring our programs and services are working for every North Carolinian. Next slide, please. So when you look at our vision and vision statements, they are not separate. They build on each other to achieve one overarching goal: advancing health outcomes for all North Carolinians. At the agency level, DHHS sets the foundation, improving health, safety, and well being for everyone. The health portfolio takes that a step further by embedding equity through trust and collaboration, because we know health outcomes improve when communities feel heard and respected. Then OMHHD focuses on the most vulnerable populations, advocating to eliminate disparities and integrate access for all. So each layer reinforces the other. DHHS provides the broad version. The health portfolio operationalizes equity, and OMHHD drives targeted strategies to make sure no one is left behind. Together, these statements reflect one shared commitment: fair and just opportunities for health. Next slide, please. OMHHD serves with a partner and community driven approach, and that really comes through in 6 key areas. We start with data because data helps call for action, engage influencers, and connect communities to the right resources. We focus on education, advancing the science and practice of equitable health through leadership, consultation across DHHS. We emphasize promotion, working collaboratively to reduce health disparities and promote solutions for better population health. We prioritize communication and messaging, making sure stakeholders are informed with clear, solution driven information. We lead with outreach and engagement, acting as connectors and ambassadors to foster inclusive, community driven health approaches. Finally, we embed health equity into policies, integrating it across our organizational fabric to eliminate systemic disparities. Together, these pillars create a strong foundation for lasting health equity. Next slide, please. So here is the OMHT core team. At the helm, we have a director, Dr. Posha Pope, who leads our vision and strategy for advancing health equity. And you will see the rest of our dedicated team, including myself, working together to turn that vision into action. Each person plays a vital role in building partnerships, driving data informed strategies, and ensuring communities remain at the center of everything we do. Next slide, please. I'm going to turn it over to my colleague, Carolina. Thank you.
Thank you, Rupa, for sharing the framework of our office of NCDHHS, and it's a privilege to see so many of you on this call and share with you a little bit about our service areas and the different programmatic areas and frameworks that we cover together. So one key component of the work that we support is our Minority Health Advisory Committee. One member who is usually on these calls that you may be familiar with is La Doctora Gabriela Plasencia, who's a member of this team. It really helps to have diverse voices as part of this committee, informing ways to reduce health disparities through advocacy and equity-focused recommendations. These recommendations advise the governor and secretary of the Department of Health and Human Services about policies, programs, and strategies that impact minority health, identifying gaps in policy, law, regulation, services, access, financing, and prevention that affect and deeply affect minority communities. The membership consists of 15 members, including legislators, community leaders, and health professionals all across North Carolina. It ensures that community perspectives and expert advice directly inform state leadership on health policy and systems change. This helps strengthen our state's ability to address the persistent disparities that affect historically marginalized populations. Next slide. Part of our programs and networks consist of one of our most important roles within our department, which is to convene, connect, and be an ambassador for shared well-being for all North Carolinians. To focus these efforts in a coordinated and effective manner, we host different programs and service areas. Those include data and evaluation planning. That's how data informs the way we introduce and present and promote strategies across the department and with external partners. We also have community partner engagement, which includes our Interfaith Leaders Network, community-based network connections, historically Black colleges and universities, and also the Chronic Health Conditions and Communicable Disease Program, our NC Minority Diabetes Prevention Program, Cultural Competency and Language Access Program, Health Literacy, Communication, and Messaging. We focus a lot of our campaigns and promotion around the different health areas. This can include different areas across the department, like the work we've done with Medicaid or the work that we do with vaccine prevention and education, education around measles, media interviews. Also, of course, our Latinx Policy and Strategy Program, which you know from us connecting with you all week after week, is led by myself and Francisco Guzman. And you'll also have an opportunity to meet some of our other colleagues today joining our call, and they'll be telling you more about the different ways our programs interact and serve all North Carolinians. Next slide, please. So just to touch briefly on data and evaluation and how data supports the work that we do to identify, monitor, and communicate disparities in health outcomes across our state. This program focuses largely on developing our health disparities analysis report. We'll share here in just a moment in the chat a copy to the links of our health disparities reports. Those are available in English and Spanish. We are now actively working towards the next publication of our health disparities report, which will be released in 2027 or 2028. But it is this data that informs policy and strategy, community and partner engagement, and health literacy and outreach. It prioritizes opportunities to release health status gaps amongst the populations we mentioned and supports accountability by tracking progress of these disparities over time. Next slide. So this is a copy of the images of our health disparities analysis report. Hopefully you've already had an opportunity to see this in the various events that we've brought along copies with. and also online. Of course, this continues to be available. It has a lot of important data and, of course, highlights the different disparities that we're working to improve together. Next slide. And another important component of the work that we've mentioned centers around community and partner engagement. In order to do that, we present the outreach and engagement continuum, which includes communication, collaboration that leads to empowerment. When we call this a continuum, because we understand that this is work that continues with an exchange of information, listening. A lot of the work that we'll do includes hosting listening sessions, coming to community events, partnering to host community events so that we can continuously listen and continue the work of communicating those findings and that information through the different avenues of either strategy or policy recommendations that we have access to. Next slide. So we listen, we learn, we act, we improve, and we aim to repeat those improvements. We know that it requires data, strategy, and engagement. Each program, as we'll continue to highlight through our time with you, has a distinct role, but together co-produced impact across the department, and also we'd like to think in different communities across the state. Next slide. So putting our continuum into action includes communication, sharing, and sharing opportunities to improve our communication and messaging. We also have opportunities to provide feedback for our programs and the different networks that we have to provide that feedback. Some of us here on this call have provided feedback on messaging for different campaigns. Again, our most recent with Medicaid expansion. And of course, we'll continue to collaborate as some of those changes to HR 1 continue to impact the different populations we serve. And of course, communicating with you all that information, receiving your feedback so that we can evaluate the different ways that we're sharing information and the different areas and communities where it needs to continue to be shared. Next slide. So I'll pass it over to my colleague, Polly, who will tell you a little bit more about community and partner engagement.
Hey everyone, my name is Polly Cox. I am a community and partner engagement manager here in the office. I've been on the team since June. And so a little bit about my role as a CPE manager is that through this, we emphasize bidirectional engagement, building trust with communities. We have we want to build a collaboration that's tailored to that community that we're working with. The goals are to build connections, sharing and learning together, providing resources, and lifting up community voices. Some of the ways that we do that are through our H&P Connections meetings. Those are once a month. You'll hear a little bit more about that coming up. And then we have the Cafecito Spanish language town halls. What I do in my work is I typically work more so with the tribal communities here in North Carolina. So I go to events, I set up at powwows, cultural events. If you go to the next slide, I can show some pictures of me at some events. There I am. So this first picture, that's me at the UNC Healthy Natives Gathering event over in Chapel Hill. I got to speak a little bit about what our office does and how we can support the tribal communities, trying to get an idea what their needs are. There's Francisco at an event as well. And next slide. And there's Miss Danita. You'll be hearing more from her coming up. She has been doing CPE engagement, and she's working more so now with our diabetes prevention program. And there I am with an intern because we also collaborate with the other departments and divisions here at DHHS. So this event where I was at a presenting on a suicide panel with one of the LB MCOs. So a lot of partnerships with the community and within the state. And I think, yeah. All right.
All right. Thank you. Thank you, Polly. Polly. This is Danita, and I will be sharing with you some information about our H&P Connection virtual meetings. And I apologize if you see my side view. I'm reading from one screen and looking at y'all from another. So anyway, our historically marginalized populations connections is a diverse network of community-based organizations, state-level partners, and health equity champions. And some of you on this call, I recognize the names. So thank you so much for joining us. Continue to join us, please. Membership is inclusive of, but not limited to, racial and ethnic communities, LGBTQIA plus communities, disability communities, religious communities, and other H&P communities, advisory groups, coalitions, task force groups, partnership groups. Y'all, the list goes on and on. Faith-based and community-based organizations. And our meetings offer card services, American Sign Language and English to Spanish, and Spanish to English interpretation service, diverse topics during the year to support our, and diverse topics during the year to support our North Carolina families. I also have the privilege to work with the North Carolina Minority Diabetes Prevention Program, and I'll share a little bit about that. In response to 2.7 million North Carolinians having prediabetes and 1/3 of them being from communities of color, the North Carolina General Assembly provided funding to NCDHHS for the establishment of the North Carolina Minority Diabetes Prevention Program, NCMDPP for short. Established in 2017, this program aims to create and implement a statewide framework that will reduce diabetes prevalence in communities of color. And what this program does is it consists of 3 key components: community screenings and focused marketing campaigns, 12-month NCMDPP lifestyle class series, and community conversations. Now, why this matters is that NCMDPP programs are designed to help people with pre-diabetes take charge of their health and well-being. And these evidence-based programs run for 12 months and can help people with prediabetes or those at a high risk of developing type 2 diabetes lower their risk of developing type 2 diabetes by up to 58%. The North Carolina Diabetes Prevention Program. Did you know that 12.4% of adults have diabetes? And 25.8%, or 2,765,000 people in North Carolina have pre-diabetes. 1/3, again, of the people with pre-diabetes in North Carolina are from communities of color. And here's our map representation, how we cover, and we're actually getting ready to cover all 100 counties in North Carolina. But our regional collaborative partners work to engage, screen, and provide the CDC curricula to communities of color in their respective regions. And I will turn it over to my colleague, Juan Ortiz, to share a little bit about class.
Thank you, Sister Dee. Happy Wednesday afternoon, everyone. And thank you to Latin 19 for hosting us and for giving us the opportunity to share in your space today. My name is Juan Ortiz, and I'm the Program Manager for Cultural Competency and Language Access at the Office of Minority Health and Health Disparities. My charge is to oversee the National Cultural and Linguistically Appropriate Services Standards. These are a federal framework that helps organizations deliver health services that are respectful, understandable, and responsive to people's cultural and language needs. So class is not a program per se, but it's a framework guiding communication, engagement, and service provision based on a population health approach. There are a total of 15 standards across 4 focus areas. These focus areas include area number 1, which also serves as a principal standard. In the standard number 1 reads, to provide effective, understandable, and respectful quality care and services that respond to cultural health beliefs and practices, languages, health literacy, and other communication needs. The second focus area is governance, leadership, and workforce. And there are 3 standards covering this particular area. For area 3, we have communication and language assistance, and there are 4 standards covering this area. And lastly, there's engagement and accountability, and there are 7 standards covering this area, including quality improvement and sustainability. Now, you must be wondering why class matters and what is the intrinsic value of the standards. Well, these standards were developed over a quarter of a century ago by the Federal Office of Minority Health as easy to implement, best practice-based service delivery guiding principles. The standards support health literacy and effective communication. They also align with equity-centered population health service delivery, and they strengthen provider capacity, so they support the elimination of disparities in health, improve community and partner engagement, and promote accountability. Next slide, please. Another program that we have here at the Office of Minority Health and Health Disparities that is a key component of what we do is our communications, health literacy, and messaging program. We all come together to support this particular effort, but we have a specialist who oversees the communications, health literacy, messaging program. And this program basically ensures that health information is clear, actionable, cultural responsive, and easy to understand for all people, especially those people statewide with limited English proficiency or low health literacy. So the program basically creates strategic communications, provides health literacy leadership. It also is involved in trainings and resources, and ensures that there is actionable language access and translation support. Some examples of how communication, health literacy, and messaging can impact health delivery. In the past couple of years, especially during the respiratory virus season, strategies for community outreach, mobilization, and public health alerts were significantly improved compared to previous efforts. Also, information and educational tools such as fact sheets, social content, community-ready materials were made fully accessible for different communities statewide. And finally, efforts were invested to increase partner collaboration's capacity to communicate clearly and effectively. And now I will hand it over to my next colleague to talk about Hispanic Latinx Policy and Strategy Program.
Gracias, Juan, and thank you again for the space. As Carolina mentioned, we have this Hispanic Latinx Policy and Strategy Program, and that it's been part of our strategy to focus Latinos. But I have a quick question today for you guys. Tell me, why do you think that we have a Hispanic Latinx program? Who can give me an answer in the chat? Why we have a Hispanic Latinx program? Don't say anything, Carolina. Don't say anything, Juan or Danita or Rupa or Polly. Nobody can guess why? Maybe tomorrow? Because we are an awesome population. That's a good point. Right. There is a need. There is a need because we have more than 1,003,000 Latinos, Hispanic here in North Carolina. That is why I'm going to briefly explain about what the program does And I'm really sure you've been seeing all of us in some outreach events, in presentations and everything. But basically, when we are talking about policy and strategy development, we support culturally responsive policies and department-wide strategies that address Hispanic Latinx health priorities. We try to connect very well inside the department. The department is a world. Believe me, when you are working in the Department of Health and Human Services of North Carolina, you learn every single minute because it's very big, as Rupa mentioned in the beginning. As a community partner engagement, we build and sustain partnerships with community-based organizations, advocacy groups, coalitions, community leaders, alliances. We try to connect with those trusted messengers. You here, you are a trusted messengers for the community. That's why the very important opportunity that Latin and Team provide us today to inform how we are working down there. We as well provide consultation, guidance, and capacity building support for DHHS divisions. There are some divisions that maybe they don't have any Spanish speaker and they would like to connect with the Latinx Hispanic community in North Carolina. And we've been close to them to try to coach them and try to inform what about the strategies that we are following to touch base with our Latinx community. We as well promote culturally and linguistically appropriate communication, resources, and outreach. All the time, we are advocating, yes, that's the word, to have a perfectly flyers in our own languages, not just a Spanish language, for another languages as well. As you know, or some of you know, oh, I have another question. Sorry for the trivia time. How many languages it is supposed that we have in North Carolina? Give me a number in the chat or in the mic.
How many languages?
Spoken in North Carolina, dear Perla, yes.
North Carolina? I don't know.
Give me a number. I'm going to give you
20.
a clue. More than 200.
More than 200, yes. Okay, fine. I don't know.
Give me more. Give me more. Go to the final number.
You have a lot in the chat.
We have 385 spoken language. Yes, it is incredible. We have a lot. But that's why we deal with Spanish information and other languages is in some of our chaotic areas that we have with the community. As well, we have a public awareness and education. We are supporting targeted education efforts on priority health issues impacting Hispanic Latinx community. And of course, our program is working in a community center engagement and a cross-divisional collaboration. I think it's essential here in the Office of Minority Health and Health Disparities, Carolina, Juan, and I, we are the Latino, but of course, all the team, we get the insight for all the team of how we connect with Latinos, Hispanics, and other communities, because it matters. It matters that specific connection. Next, please. Como saben, I'm going to switch to Spanish. Nosotros tenemos cafecitos y estos cafecitos han estado impactando a la comunidad. Hemos hecho cafecitos tanto de salud mental como cuestiones respiratorias y próximamente hagamos algún otro cafecito de algún tema en salud que esté en este proceso con nuestras comunidades de entendimiento. Lo que nosotros hacemos con estos cafecitos es impactar a la comunidad hispana latina porque son cafecitos totalmente en español y son cafecitos que mencionan las herramientas necesarias para que nuestras comunidades puedan conectar. Como saben, esta es temporada de enfermedades respiratorias y recientemente tuvimos un cafecito donde nos acompañó la doctora Viviana y Dulce Ortiz. Gracias, doctora Viviana. Sé que no está aquí el día de hoy, pero gracias por siempre estar con nosotros apoyándonos. Pero también saben que es la temporada de sarampión. Por favor, les invitamos, y hago un paréntesis breve, tenemos un número que va incrementando todos los días de casos de sarampión en Carolina del Norte. Voy a pedirle a mis compañeros si pueden agregar la información que tenemos de sarampión en nuestra página web, porque quiero que nuestra comunidad esté enterada. Necesitamos enterarnos de qué es lo que está pasando a nuestro alrededor, porque no sabemos si el vecino de al lado pueda tener una situación, alguna enfermedad. Next, please. Denira, are you there? Next, please. Thank you. We have this bilingual newsletter that I think some of you are already in. If you are not, please follow us. You have the signing QR code, and you will receiving every month a bilingual newsletter with the most updated news that we have in the department or even in the community. This newsletter is to support other partners. If you have anything that you consider we need to reflect around the state, don't hesitate to send us an email to Carolina, to me, and then we are going to be able to reflect it in our bilingual newsletter. The newsletter is going to come with information that what's going on right now with health in North Carolina, plus other news regarding our allies, our partners. Please sign in. It's very easy. You don't have to belong to any organization. As a community leader, as a member of the community, you are part to be here in the noticias. They will ask you just quick questions regarding that. Next, please. Okay, now we have another newsletter that we call it Healthier Communities. The Office of Minority Health and Health Disparities used to have this Healthier Communities newsletter, but we has relaunched the Healthy Communities newsletter. And this is a bilingual publication as well. This is quarterly. You will find as well really good information in deep stories, data insights, and community highlights from across North Carolina. There are two different ones. One is the bilingual noticias, and the other one is the Healthier Communities. And we will send you the information and we'll share with Latin 19 how you can connect with Healthier Communities and newsletter. Next, please. Now, we want to touch base because I'm really sure some of you that were here, you joined us last year in our Access to Care sessions. We had 6 sessions around the state from April to September. And thank you to my colleagues that are here in the call to support us. There are some colleagues here today that they support us in the logistic. Really appreciate all your help always. And these sessions, provide health navigation information for, of course, equip community health workers, faith-based leaders, community organizations, and community per se. We have a lot of attendees in each sessions, and we actually connect with agencies accordingly of the counties, of the regions. As you imagine, we are divided as a Medicaid regions. Remember, 6 Medicaid regions in North Carolina, and we visit the 6 regions with this access to care. And next, please. Those were the places that we visit, and each region had a focus. You can read what we had in each region because it was the top of the issues that were like in the specific regions. And we have like community leaders explaining how to connect with tools. We have hospitals, we have universities. As you can imagine, the Latinx and Hispanic community is 208 times more likely to not see a doctor due to the cost, and as well because they are afraid. As you can imagine, nowadays we have this afraidness to go to government places, and that's why that is another reason that why we are here. We want you to inform you how the department is working and the confidence with the leaders that you are, the trusted messengers out there. Next, please. Just briefly, results that we have, 6 regional seasons that we had, and we engaged with more than 334 organizational partners, and 230 attend these sessions in the different sessions. And to be honest, we reach maybe more than 250,000 individuals because all the organizations and community members who were attending at that time, you were providing that information and you were replicating all the information that you learned. We were talking about Medicaid, Medicare, federal qualified clinics, Medicaid ombudsman, mental health, all those topics that you can imagine that our community is struggling right now. Not just the Latino community, I'm talking about all vulnerable communities or underserved communities. Next, please. And quickly, because then we are not going to have time for questions, we have this electronic request form. If you want to contact us, please use this information. My colleagues are going to paste the link. And basically, this form is designed to get a request from the Office of Minority Health and Health Disparities. It's a customer relation management tool. Using this electronic request, we will have this handling request from all the partners around North Carolina. Don't hesitate to send us your request. It's easily to sign in. Next, please. Why you can find this, because we encourage our partners to use this electronic portal. You can submit requests for services as trainings, newsletters, subscriptions, panel discussions, technical assistance, support for advisory group, presentations, media communications, anything you think that we can help, we're going to be waiting for your request through this tool. Next, please. And think of Office of Minority Health and Health Disparity Programs and Network as an integrated loop, not a linear pipeline. Listen, learn, act, improve, and repeat. Thank you very much.